Hi, my name is Brianna Agnew, and this past year I have had the incredible opportunity to intern with the University of Washington's Firearm, Injury, and Policy Research Program. I am grateful to be able to share the initial findings of my work on female firearm suicide, a descriptive study of precipitating circumstances across the lifespan. Suicide is a preventable and important public health topic. It is currently the 12th leading cause of death among all individuals in the United States. In 2020, nearly 46,000 people died from suicide, increasing by 30% over the last 2 decades. The incidence of suicide is 3.5 times higher among males compared to females. However, since 2000, the suicide rate has increased faster in females, narrowing the male to female suicide rate ratio. For women ages 10 to 55, suicide is the fifth leading cause of death. However, the increasing rate is significantly disproportionate among younger females. Over the last 2 decades, adolescents 10 to 14 had a 233% increase in suicide, which is now the leading cause of death for their age group. And females 15 to 24 saw an 87% increase, making it the third leading cause of death in their age group. Violent methods of suicide have also increased. Firearms are now the leading method of suicide for females, accounting for almost 1 in 3 fatalities, a shift away from poison-related suicides, which was the leading means for the last 20 years. Previous research reported a suicide paradox in which higher suicide attempt rates were observed in females, but higher suicide fatalities are observed in males, attributed in part to differing suicide methods. The trends of firearm used in female suicides could indicate an increase in case fatalities. Given the increase of female suicide over the past 2 decades, especially among youth, coupled with the prevalent use of firearm in the fatal injury, highlight the urgent need to understand circumstantial factors associated with female firearm suicide. Because firearm suicides have been historically associated with males, this information is understudied in scientific literature. Therefore, the purpose of this study is to describe the precipitating circumstances of female firearm suicides and examine circumstantial differences across the lifespan. Specifically, my research questions are: what are the precipitating circumstances associated with female firearm suicide decedents in the United States? And does the age of the decedent affect the distribution of precipitating circumstances across the lifespan? To answer my research questions, I examined the Centers for Disease Control and Prevention's National Violent Death Reporting System data. NVDRS is a population-based active surveillance system of all violent deaths in the United States. The database is compiled using information from death certificates, law enforcement reports, and medical examiner or coroner reports in an effort to capture a rich understanding of the violent death. For my study population, I used a random sample of 18% of all female firearm suicides from 2014 to 2018, resulting in a sample size of 1,462. For my data collection, I used the NVDRS coded variables and manually coded the medical examiner and law enforcement narratives for 18 additional precipitating circumstances specific to female suicides that were not included in the NVDRS codebook. The 18 additional variables were identified during the study design through a literature review and content analysis. Then descriptive statistics were calculated for all decedents and stratified by age. The age of females who died from firearm suicide ranged from 11 to 95 with a mean age of 47. 37% had a high school degree, 20% had a bachelor's degree or higher, 38% were married, 26% were divorced or separated, and 8% were widowed. 1% of females were American Indian or Alaska Native, 2% were Asian or Pacific Islander, 5% non-Hispanic Black, 4% Hispanic, 87% non-Hispanic White, and 1% identified as 2 or more races. Firearm circumstances were examined by looking at storage, owner, and type. Research has shown that unsafe firearm storage practices are associated with an increased risk of suicide. Across all ages of female firearm suicide decedents in our study, only 16% of the firearms used for suicide were stored safely, locked and unloaded, while 53% were stored unsafe, unlocked, and loaded. 1 in 2 women used their own firearm, 1 in 10 used their parents, 1 in 4 used a family member other than a parent, and 1 in 10 used a friend's. 91% of firearms used were handguns and 9% were long gun. Mental health disorders were a top precipitating factor among all ages of females. 54% of women had 1 or more mental health diagnoses, but just 30% were currently being treated for a mental health or substance use disorder. 32% had a history of suicidal thoughts or plans, and 23% had a history of prior suicide attempts. 30% had an alcohol or substance use disorder. And among the 54% of women known to have a current mental health condition, 80% were diagnosed with depression, 20% with anxiety disorder, 17% with bipolar disorder, 3% with post-traumatic stress disorder, PTSD, and 2% with attention deficient hyperactivity disorder, or ADHD. When we break down the circumstances by age groups, the prevalence of known mental health diagnoses start to differentiate across the lifespan. Having a diagnosis of depression was significant among all age groups, ranging from about 70 to 90%. However, the prevalence of depression was highest among females less than 18 years old at 90%, and ADHD was also prevalent in that age group at 15%. Anxiety disorder ranged from 5% in females less than 18 years old to 25% in females over 85. It peaked in waves starting in women aged 25 to 34, then again between 45 and 54, and finally in women over 75. Bipolar disorder ranged from 0% in females over 85 to 20% in females 25 to 44. The prevalence of PTSD ranged from 0% in females over 75 to 5% in females younger than 18 and 25 to 34. These findings suggest that the distribution of precipitating circumstances shift across the lifespan. For example, relationship problems were frequently observed in all age groups of women, but significantly declined in women over 75, whom the relationship problem was with varied. For example, family relationship problems were prevalent in 30% of females younger than 18 and peaked again in middle-aged women 45 to 54 at 13%, but was not observed among women 85 years and older. Whereas romantic relationship problems with the most recent partner was more frequently observed in young adults and middle-aged women with a prevalence of 45% and 21%, compared to 16% of teens and adolescents and 0% in women 85 and older. Alcohol or substance use disorder was prevalent among young adults and middle-aged women as well. It was highest among 25 to 34-year-olds at 45%, compared to 14% of those younger than 18, and 0% among women older than 85. The distribution of physical health problems such as acute or chronic pain steadily trended upwards across the lifespan and was most prevalent in 38% of women over 85, but also observed in 8% of women 25 to 34 years old and 5% of women younger than 18. Some precipitating circumstances seemed entirely unique to an age group. For example, being bullied was almost exclusive to females younger than 18, with a 21% prevalence, while child custody problems were mostly observed in women aged 25 to 34. And dementia or Alzheimer's disease was reported most frequently in women older than 75. The strengths of this study are the random sample design using the rich data obtained through NVDRS, including manually coded female firearm specific variables to identify age and gender specific precipitating circumstances of firearm suicide. The limitations of the study involved the high proportion of unknown and missing information that relied on law enforcement interviews and coroner reports post-mortem. Additionally, the random sample of manually coded variables reduced the number of women in each age category. These findings suggest that behavioral health conditions such as having a mental health diagnosis was prevalent among all age groups. Additionally, unsafe firearm storage was observed across the lifespan. However, themes emerged from the data that suggest the prevalence of specific circumstantial factors relating to relationships, physical health, and life stressors vary across the lifespan. Next steps include examining racial and ethnic differences in precipitating circumstances, as initial results may indicate a disproportionate rate of firearm suicides in younger generations of American Indian Alaskan Native, Asian, Hispanic, and non-Hispanic Black females. After all analysis is complete, I plan to submit my study for publication. The findings of this descriptive study can be used to generate research on effective evidence-based prevention strategies. Suicide is a complex issue associated with many circumstantial variables, but prevention will be more effectively utilized through targeted age-specific interventions. With the understanding of how the precipitating circumstances to female firearm suicide shift across the lifespan. Finally, I would like to acknowledge my team at the Firearm Injury and Policy Research Program. This research would not have been possible without them. Thank you.